Sir, it is common that facial nerve supplies muscles of facial expression, but I have seen a patient with facial nerve palsy has also hyperacusis. Why is that?
Hyperacusis, look, the biggest misconception about the facial nerve is that it supplies the muscles of facial expressions to its five famous branches: temporal, zygomatic, buccal, marginal, mandibular, and cervical. But it's not the fact. Facial nerve, in fact, has 10 branches, being on the minimum side. Look what happens. Facial nerve arises from the brainstem or at the pontomedullary junction as two roots. One is the motor root, and one is the intermediate nerve or nervus intermedius, which carries parasympathetic as well as special sensory fibers. As it goes into the facial canal, these both roots merge and the facial nerve is formed. First branch inside the facial canal is greater petrosal nerve, which gives parasympathetic fiber to the pterygopalatine ganglion and ultimately to the lacrimal gland. The second branch is a motor nerve, which supplies the stapedius, a muscle of the middle ear. That's why if it is paralyzed, the patient will have hyperacusis. And the third branch inside the facial canal is chorda tympani, which gives parasympathetic supply to the submandibular and sublingual salivary gland, while also to the and also gives taste sensations, carries taste sensations from the posterior one third of the tongue. Then it emerges out from the stylomastoid foramen. It gives two more branches: posterior auricular, a motor nerve, and a motor nerve to the posterior belly of digastric. Only then it enters the parotid gland and gives these five terminal branches. Now, if the lesion is only of the intermediate nerve, the patient will have parasympathetic and special sensory loss. If there is a damage of facial nerve as a whole inside the facial canal, all of these 10 nerves will be damaged. However, after seeing the level of the damage, we can say okay, if only the muscles of facial expressions are being paralyzed, even hyperacusis is being seen in the patient, and even loss of parasympathetic supply and taste sensations is seen in the patient. It will be defined on the area where the facial nerve is damaged. Thank you.